Ascorbic acid, also known as vitamin C, is important for maintaining the health of your skin, cartilage, teeth, bone, and blood vessels. It is also used to protect your body's cells from damage. Low levels of vitamin C can lead to a condition called scurvy, which may cause symptoms like rash, muscle weakness, joint pain, tiredness, or tooth loss. Most people who eat a normal diet do not need extra ascorbic acid. However, if you have low levels of vitamin C, you may consider taking C-500 500 mg chewable tablets to prevent or treat this deficiency. It is recommended to take one tablet daily, preferably with a meal. This can help ensure that your body is getting the vitamin C it needs to stay healthy. Remember, it's always best to consult with a healthcare professional before starting any new medication or supplement. Now let's talk about the uses and dosage of C-500 500 mg chewable tablet. You can take this vitamin by mouth with or without food, usually 1 to 2 times daily. It's important to follow all directions on the product package, or take as directed by your doctor. If you are taking the extended-release capsules, make sure to swallow them whole. Do not crush or chew extended-release capsules or tablets, as this can release all of the drug at once, increasing the risk of side effects. Take this product with a full glass of water, 8 ounces/240 milliliters, unless your doctor directs you otherwise. For the wafers or chewable tablets, be sure to chew them thoroughly and then swallow. And if you are taking the lozenges, simply place the lozenge in your mouth and allow it to slowly dissolve. If you are taking the powder, mix it thoroughly in the proper amount of liquid or soft food and stir well. Take all of the mixture right away, and do not prepare a supply for future use. And if you are using the liquid form of this vitamin, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. The dosage of C-500 500 mg chewable tablet is based on your medical condition and response to treatment. It's important to use this vitamin regularly to get the most benefit from it, and to help you remember, take it at the same times each day. And remember, if you think you may have a serious medical problem, be sure to get medical help right away. Side effects of C-500 500 mg chewable tablet may include diarrhea, nausea, vomiting, abdominal cramps/pain, or heartburn. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, you should seek medical attention if you experience painful urination or pink/bloody urine. While a severe allergic reaction to this drug is rare, it's important to get immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of potential side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the optimal timing and dosage, it's best to follow your doctor's instructions. Typically, C-500 500 mg chewable tablet is taken as directed, usually once a day. However, be sure to consult with your doctor for personalized guidance. Before taking C-500 500 mg chewable tablet, it's important to check with your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease or a certain enzyme deficiency. If you are planning to have surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, it has been found that this vitamin is safe to use in recommended doses. However, higher doses should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. This vitamin also passes into breast milk and is considered safe during breastfeeding when used in recommended doses. It's always best to consult your doctor for more information. As always, it's recommended to follow your healthcare provider's advice on the best time and daily dosage to take this medication. When taking C-500 500 mg chewable tablet, it's important to be aware of potential drug interactions. This can affect how your medications work and may increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to note that this vitamin may interfere with certain lab tests, including certain urine glucose tests, which could potentially cause false test results. It's important to inform lab personnel and all your doctors that you are using this drug to ensure accurate test results. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can reach the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep all of your medical and lab appointments. It's important to note that this product is not a replacement for a balanced diet. It's always best to get your vitamins from a variety of healthy foods. Ascorbic acid, which is found in C-500 500 mg chewable tablet, can also be found in citrus fruits like oranges, as well as tomatoes, Brussels sprouts, cauliflower, and broccoli. If you have any questions about the best way to get your vitamins, be sure to consult your doctor, pharmacist, or nutritionist for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for the next dose, skip the missed dose and take the next one at the regular time. Do not take 2 doses at the same time. When it comes to storing C-500 500 mg chewable tablets, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. When it comes to discarding the product, make sure to do so properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of the product. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.